If you just found out that you have a meniscus tear, there's a good chance that you came onto YouTube and you started to search what a meniscus tear is, and you immediately start wondering, can I still work out? Can I still squat? Can I start running? Can I still run? Am I making the tear worse by working out and putting pressure on my knee? And what exactly am I supposed to do about this besides get surgery? If that's you, you're in the right place. I'm Dr. Kiani Adams. I'm a physical therapist and fitness coach, and this is part one of how to work out with a meniscus tear. Throughout this series, we're going to talk about what a meniscus tear actually is, the different type of meniscus tears, why strength training is so important after getting diagnosed with a meniscus tear, and most importantly, how to keep working out and hitting your fitness goals with the tear. But before we get into any of that, this video is going to talk about specifically what a meniscus tear actually is and what your meniscus does so that you can know how to proceed going forward. And if you're watching this and you're trying to figure out the exact exercises that you should be doing for your knee right now, join us inside the Knee Lab. It's an online knee rehabilitation and online training community where I teach you how to assess your knee with the exact assessments and tests that I use as a physical therapist. So it'll be as if you came to me one-on-one and we went through an evaluation. I help you figure out what your knee is capable of right now, the things that it's safe for you to do, and how to get back to lifting heavy, running, jumping, and training the way you're used to or the way you want to, despite having a meniscus tear. So instead of just knowing that you have a meniscus tear and not knowing what to do about it and randomly trying different exercises online, you actually have a way to figure out where you should start and what you should be working on right now. I'll put the link below in the comments and also the description to join. But for now, let's dive into what a meniscus tear is. A lot of people get told they have a meniscus tear and they don't really understand what it means and how it is or isn't going to impact their life. And that leads to a negative domino effect because they start to believe they can't work out, they can't do certain things. They start to baby their knee, and that leads to other negative health consequences. So if we can understand what the meniscus is, the role of it, and how to deal with it, we can approach it a lot better and continue to get in shape, stay in shape, and hit your fitness goals without feeling like you have to baby yourself. So in your knee, you have two menisci. Menisci is plural for meniscus. So you have a medial one and a lateral one. And they're pieces of fibrocartilage that sit between your thigh bone, which is called your femur, and your shin bone, which is your tibia. So here, shown in the green, is your meniscus. So if we rotate your knee around, this is the front of your knee, right? So let's just orientate ourselves. This is as if you were looking at somebody standing in front of you, right? So the meniscus are these two like circle shaped structures between your thigh bone, your femur, and your tibia. Now, your meniscus isn't just some random piece of tissue sitting in this area between your thigh bone and your shin bone. It actually has a job, and its job is really, really important. So one of the biggest roles of the meniscus is to help distribute force throughout your knee. So think about everything you do during your day. Walking, standing up from a chair, going up and down stairs. And then when you talk about going to the gym, squatting, running, jumping, lifting weights, all of those activities create a lot of force that your knee has to handle. Your meniscus helps to distribute those forces across the knee joint and help your knee feel stable. So let's say that there's a meniscus tear here. That just means that there's a structural change or some type of disruption inside this tissue. And depending on what's going on with your knee or how severe the meniscus tear is, you may start to have symptoms that are associated with that tear. And the symptoms aren't really universal across the board. You can take two people that have a meniscus tear and their symptoms are going to be vastly different. In fact, there's tons of people who have no symptoms, no pain, have no idea that they have a meniscus tear. And if you MRI them, it'll show up with a meniscus tear. And then you have people who have a lot of pain and they're having symptoms, and then they also have a meniscus tear. So I share that to say you can absolutely have structural changes and tears in this area without even knowing. So some classic symptoms of a meniscus tear can be swelling. You may have difficulty completely bending or straightening the knee. You may notice some catching or clicking. You may notice that your knee feels a little less stable, or it will occasionally buckle. You might start to notice that like deep squats or deep knee bends start to bother you more than other types of exercises. Twisting motions might bother you, going down the stairs might bother you, or like I said, you might not even have symptoms at all. And I keep emphasizing this because simply having a meniscus tear doesn't necessarily tell you exactly how your knee should feel or what your knee is physically capable of doing, especially in your workouts, which we'll get into this topic in much more detail in the later videos in this series. For now, I just want you to understand what the meniscus is, what it looks like, and a brief overview of the role of it so that we can talk about how to address meniscus tears if you do have one and what's really important to keep your knee healthy despite being diagnosed with a meniscus tear. So if you take anything away from this first video, it's this. Your meniscus sits between your thigh bone and your shin bone, and it helps spread pressure across your knee joint, absorb shock, and contribute to your knee feeling stable. A meniscus tear means there's been a change somewhere in that tissue, but the diagnosis of a meniscus tear alone does not tell us how well your knee can work. And it definitely doesn't tell us that you need to stop using your leg. Which brings us to the next question. If my meniscus helps my knee handle pressure and now it's torn, why would strength training be a good thing? Why would I continue strength training, and what should I do instead? That's exactly what we're going to talk about in the next video, because your meniscus isn't the only thing that helps support your knee. Your muscles have a huge role too. And once you understand that, it'll make a lot more sense why getting stronger is such an important and crucial part of managing a meniscus tear and getting back to hitting your fitness goals.